5 health checkups you should avoid after 70 that may harm you more than help. There's a truth very few people over 70 ever hear directly. Most doctors will tell you to keep up with your routine checkups, do every test, and stay on the safe side. But here's the uncomfortable question. Are all those tests really helping you stay healthier, or could some of them quietly do more harm than good? I'm a doctor who has worked with older adults for many years, and I have to tell you honestly, modern medicine is powerful, but it's not perfect. Especially after 70, your body changes, your risks change, and not every screening still makes sense. Sometimes what looks like early detection leads to unnecessary treatments, anxiety, or even complications that affect the rest of your life. Recent research shows that up to 37% of medical tests in seniors lead to treatments they never needed and lifelong side effects they never expected. And here's the shocking part. 99% of people over 70 have no idea they're being overtested. In this video, I'll share 5 common health checkups you should think twice about after 70. I'll explain why they can sometimes harm more than help, and what smarter, safer options you can consider instead. And please, watch until the very end, because the number 1 test on this list is linked to 5% of all cancer cases in the U.S. That's the same risk level as drinking alcohol every single day. Leave a comment. Where are you watching from? How old are you? And have you ever regretted a test or procedure? Hit like and subscribe to Dr. Reacts Senior Health so you don't miss important health truths that can truly protect you. Now let's begin with the first test, one that seems harmless but can quietly take away your quality of life. Let's talk about a test that sounds completely harmless. The bone density scan, also called a DEXA scan. It's quick, painless, no needles, no fuss. You lie down for a few minutes, and the machine tells you how strong your bones are. Sounds reasonable, right? Especially since we all know bones become thinner with age. But here's the hidden truth. Most seniors are never told. After 70, a bone density scan often creates more fear than benefit. Here's why. Bone loss is a natural part of aging, just like wrinkles or gray hair. It happens to everyone, even the healthiest seniors. But when you see the numbers on the screen, osteopenia or low bone density, it feels like a diagnosis. And the next thing that happens? You're often prescribed strong medications like bisphosphonates that promise to strengthen your bones. But do they really help? Not as much as you think. A study published in the Journal of the American Geriatric Society followed over 1,200 women over age 70. After 5 years, those taking bisphosphonates had only a 0.3% reduction in fracture risk. That's almost nothing. Meanwhile, the side effects were far more common: jawbone damage, painful heartburn, inflammation of the esophagus, and even rare fractures that happen in strange places like the thigh bone. I'll give you a real example. Rose, a 76-year-old retired piano teacher, came to me after her annual checkup. She felt fine. No falls, no bone pain. She walked every day. But her doctor ordered a DEXA scan. It showed osteopenia, not even full osteoporosis, just mild thinning. Out of caution, she was started on alendronate, a common bisphosphonate. Within 3 months, Rose had severe acid reflux and pain in her jaw so bad she stopped playing piano. She felt sicker after starting a medication that was supposed to keep her healthy. So what did we do? We stopped the drug. Instead, Rose focused on weight-bearing exercises like simple resistance band training, vitamin D, calcium-rich foods like sardines and leafy greens, and balance training to prevent falls. 1 year later, no fractures, stronger legs, better balance, and yes, she was back to performing piano recitals. Here's what matters most. For seniors over 70 who are not falling or breaking bones, lifestyle changes are far more effective than medication. In fact, a 2022 osteoporosis international study showed exercise, balance training, and proper nutrition reduce fractures by over 20%, far more than those pills. So if you're over 70 and your doctor suggests a bone density scan, ask yourself, have you had any falls? Do you have pain or fractures already? Will this scan change what you're doing? Because if the answer is no, you may just be opening the door to unnecessary worry and treatments. Focus on staying strong and steady, not chasing numbers on a screen. But the next scan on this list is even more dangerous because it doesn't just cause fear, it can actually push some seniors toward unnecessary brain surgery. Stay with me, because number 4 is one of the most overused tests for seniors worried about memory loss, and it can quietly make life worse instead of better. Now let's talk about another test that seems like the smart thing to do, a brain MRI for memory loss. I see this all the time. A senior starts forgetting names more often, misplacing keys, feeling a bit foggy sometimes, and naturally fear sets in. Am I getting dementia? Is this Alzheimer's? So what happens? Doctors often respond by ordering a brain MRI, a detailed scan that shows the structure of your brain. But here's the uncomfortable truth. In most people over 70, an MRI rarely gives helpful answers. Why? Because normal aging changes the brain. After 70, most MRIs show things like mild shrinkage or small white spots called white matter changes. These are completely normal for your age. But when you see them on a report, it feels terrifying, like something is wrong with your brain. And here's where the trouble begins. A 2021 study in Neurology Today looked at over 3,000 seniors aged 70 to 85 with mild memory complaints. Guess what they found? 86% of MRIs showed some kind of abnormality, but only 3% were linked to a real, treatable condition. That means 97% of seniors went through the stress of hearing there was something wrong when there really wasn't. And it doesn't stop there. Once the MRI finds something, doctors feel pressured to investigate further. More scans, sometimes even a spinal tap, or in rare cases, a brain biopsy. All of this for findings that are just normal aging. Let me tell you about George. George was a 74-year-old retired engineer, sharp, independent, loved fixing things around the house. But lately he misplaced his keys more often and sometimes forgot names at church. His doctor ordered a brain MRI. It came back with mild white matter changes and age-related atrophy. George panicked. He was convinced he had early Alzheimer's. He stopped driving. He stopped socializing. He fell into anxiety and depression. But when we brought him in for a simple cognitive screening test, his memory and attention were perfectly fine for his age. We explained those MRI findings were normal for a man in his 70s. We helped him focus on better sleep, hydration, mental exercises, and staying active. Within 3 months, George felt like himself again. No dementia, just normal aging. That's why I tell my patients, unless you have severe neurological symptoms like seizures, sudden personality changes, or rapid decline, an MRI for mild forgetfulness is rarely helpful. A better first step? A simple cognitive screening test, a paper and pencil assessment that checks memory, attention, and problem solving. It's cheap, non-invasive, and avoids unnecessary panic. Plus, focus on proven memory boosters, good sleep, hydration, regular physical activity, and staying socially engaged. Because here's the truth. Forgetting a name sometimes is not the same as dementia. So, before you rush into an MRI that might create more fear than answers, talk with your doctor about whether it will truly change your care. Now, let's move on to the third test, one that's incredibly common and often leads to unnecessary heart procedures, stents, and even hospital stays. Keep watching, because number 3 is one of the most overused tests for seniors with mild fatigue or chest tightness, and the hidden risks may surprise you. Let's move to another very common test, the cardiac stress test. It's one of the first things doctors order when a senior says, "I feel more tired lately," or "I get a little tightness in my chest sometimes." On paper, it makes sense. The stress test monitors how your heart performs while you walk on a treadmill, or, if you can't exercise, while you're given medication to simulate exercise. It's supposed to detect blocked arteries before they cause a heart attack. But here's what most people don't realize. After age 70, a stress test often creates more problems than it solves, especially if you don't have clear, classic symptoms of heart disease. Here's why. As we age, the heart changes naturally. It becomes less efficient, blood vessels stiffen, and our baseline fitness level decreases. These changes can look like abnormalities on a stress test, even if they're just normal for your age. And the statistics are worrying. In adults over 70, the false positive rate, where the test says something is wrong when it isn't, can be as high as 40%. That false alarm often leads to more invasive tests, like angiograms, where a tube is threaded into your arteries, and from there many seniors end up with stents or even bypass surgery that they didn't truly need. And the kicker? Studies show these procedures often don't improve survival or quality of life in people without clear heart disease symptoms. Let me give you a real story. Raymond was a 75-year-old retired postman. He walked every day, stayed active, and was generally healthy. But during a routine checkup, he mentioned he sometimes felt tired when walking uphill. Just to be safe, his doctor ordered a stress test. The results were unclear, so he was sent for a catheterization, a more invasive test where they inject dye into the arteries. They found a mild narrowing and decided to place a stent, but that night, Raymond had a bad reaction to the contrast dye. His kidneys were damaged. He ended up in the hospital for 6 days, needed weeks of follow-up care, and guess what? His fatigue never improved, because it wasn't his heart at all. He just needed better hydration and more rest between meals. This is what I want every senior to remember. Feeling a little more tired as you age is not the same as having heart disease. If you're over 70 and you're not experiencing true chest pain during activity, severe shortness of breath, or a dramatic drop in energy with even light exercise, then a stress test may give you more risk than reassurance. What are the better, safer options? A resting EKG, a simple test of your heart rhythm while you're sitting still, or a coronary calcium scan, a low-radiation test that looks for dangerous plaque buildup without the same false alarm rate. These tests are less invasive, lower risk, and far less likely to push you into a hospital procedure you never needed. So before you agree to a cardiac stress test just because you're not feeling like you used to, ask your doctor, what would we do differently if this test shows something? And do I really have symptoms that justify it? Because here's the truth. Not every heart test makes your heart safer. Sometimes less is more. And speaking of invasive tests that might do more harm than good, the next one is even more surprising. It's something almost every senior has been told to do at least once. Stay with me, because number 2 is a screening that many doctors still recommend. But after age 70, the risks can outweigh the benefits. Now let's talk about a test you probably didn't expect to see on this list: colonoscopy. For years, colonoscopies have been promoted as the gold standard for catching colon cancer early. And yes, they can save lives when used in the right people at the right time. But here's what most seniors don't hear clearly. After 70, and especially after 75, the risks of colonoscopy often outweigh the benefits, unless you have specific symptoms. Let's break this down. A colonoscopy isn't just a quick look inside. To prepare, you have to drink strong laxatives that flush out your entire digestive tract. For a younger person, that's just inconvenient. But for someone over 70, that kind of intense dehydration can trigger dizziness, low blood pressure, kidney problems, or even fainting. Then there's the sedation. After 70, your brain is more sensitive to sedatives. Even a mild dose can lead to confusion, memory problems, or what doctors call post-anesthesia cognitive decline. In some seniors, it takes days or even weeks to feel mentally clear again. And finally, the procedure itself isn't risk-free. It can cause bleeding, especially if they remove a polyp. Rarely, it can cause a tear in the colon wall, called a perforation. And it can even trigger heart rhythm disturbances during sedation. But here's the most important part. How many lives does colonoscopy actually save in seniors over 75? A massive study in JAMA Internal Medicine followed over 1.3 million Medicare patients aged 70 and older. For every 1,000 colonoscopies done in people over 75, only 2 lives were saved from colon cancer, but 20 seniors suffered serious complications. That's a 10-to-1 risk-to-benefit ratio, and many of the polyps they find at that age are small and slow-growing. Removing them often causes more harm than leaving them alone, especially when life expectancy is already shorter than the decades it would take for those polyps to turn into cancer. Let me tell you about Dana. Dana was a 73-year-old grandmother who ran a small bakery with her daughter. She felt fine. No bleeding, no changes in her stool, no family history of colon cancer. But her new doctor, fresh out of residency, urged her to get a routine colonoscopy. During the procedure, they removed a tiny polyp. That night, Dana had severe abdominal pain and fainted. At the hospital, they found a bowel perforation. She spent 9 days recovering, lost weight, and never quite regained her old energy. And here's the sad part. She had already had 2 clean colonoscopies in the past. There was no reason to repeat it. Even the U.S. Preventive Services Task Force now recommends stopping routine colon cancer screening at 75 for most people. For those in excellent health, a safer alternative is a FIT test, a simple stool test you can do at home. It's non-invasive, no sedation, no prep, and it still catches most concerning cases. So if you're over 70, here's what to ask before agreeing to a colonoscopy. Do I have symptoms like bleeding, unexplained weight loss, or changes in stool? Have I already had clear colonoscopies in the past? Is there a specific reason to do this now, or are we just doing it because it's routine? If the answer is no, it may be time to stop chasing screening tests that could hurt more than they help. Now, let's move on to the most overused, most harmful, and most misunderstood test for seniors. Stay with me, because number 1 is a test that's marketed as preventive, but it can actually trigger a chain reaction of unnecessary scans, biopsies, and even cancers it was supposed to prevent. Finally, let's talk about the most overused and most dangerous test for seniors, full-body CT scans. They're often marketed as peace of mind or early detection packages at private clinics. Maybe you've seen the ads, get a full-body scan and catch cancer early. It sounds reassuring, doesn't it? But here's the shocking truth. Full-body CT scans have 0 proven benefit in healthy seniors with no symptoms, and they carry serious risks. Let me explain why. First, CT scans use high-dose ionizing radiation. A single full-body scan exposes you to 10 to 20 millisieverts of radiation. That's equal to about 500 chest X-rays. And here's the frightening part. According to a 2023 study in JAMA Internal Medicine, the rise in CT scans across the U.S. is now responsible for up to 5% of all cancers. Yes, you heard that right. 1 out of every 20 cancers may be caused by the very scans meant to prevent disease. That risk is on par with drinking alcohol every single day. Second, these scans are too good at finding something. Tiny, harmless nodules in your lungs, small cysts in your kidneys, calcifications in your arteries, all completely normal with aging, but once they're seen, a red flag goes up, and suddenly you're on a medical conveyor belt, more scans, more biopsies, and sometimes unnecessary surgeries, all for things that would never have harmed you in the first place. Take Marcus, for example. Marcus was 80 years old, still teaching martial arts to younger seniors. He felt great. At a private clinic, he signed up for an elite senior checkup, which included a full-body CT scan. The scan showed a tiny 3-millimeter lung nodule. His doctor panicked and sent him to an oncologist. That led to a PET scan and, finally, a needle biopsy. The result? Benign, nothing dangerous. But the biopsy collapsed part of Marcus's lung, and he ended up hospitalized for 2 months of recovery. He went from feeling perfectly healthy to being weaker, anxious, and dependent, all because of a test he didn't actually need. Experts are very clear on this. The American College of Radiology warns that full-body CT scans should never be used as general screening for people without symptoms. There's no evidence that they improve survival. And there's significant evidence they cause harm, radiation exposure, false alarms, and invasive procedures. So when is a CT scan appropriate? Only when you have specific symptoms, like unexplained weight loss, coughing up blood, or a clear abnormality that needs to be investigated. In those cases, a targeted scan of the problem area makes sense. But scanning your entire body with no reason is like searching for treasure with a landmine detector. You might find something, but the damage could be worse than what you were trying to avoid. Here's the bottom line. If you feel well, focus on staying well. Regular checkups with your doctor, smart lifestyle choices, and symptom-driven care are far safer than fear-driven full-body scans. Because after 70, the last thing you need is a test that creates more problems than answers. So there you have it. 5 common health checkups that may hurt more than they help after 70. Bone density scans that push you toward unnecessary bone drugs. Brain MRIs that create fear without giving real answers. Cardiac stress tests that lead to risky heart procedures. Colonoscopies that carry more complications than benefits past a certain age. And full-body CT scans that can actually cause cancer instead of preventing it. Modern medicine is powerful, but it's not perfect. And as you age, the smartest care isn't always about doing more. It's about doing what truly matters. So before you agree to any test, always ask, what happens if this test finds something? Will the result actually change my care? Are the risks of this test higher than the benefits for me at my age? Because real prevention starts with staying active, eating well, sleeping deeply, and making informed choices, not chasing every scan. Now I want to hear from you. Have you, or someone you love, ever faced complications from a test that turned out to be unnecessary? Share your story in the comments, and don't forget to like this video and subscribe to Dr. Reacts, Senior Health, so we can keep bringing you honest, science-backed answers for healthy aging.